Well, obesity rates in the U.S. continue to rise. With more cases, it puts a burden on patients, doctors, and the healthcare system. Mercy is adding an optional fourth year to its family medicine residency program. Dr. Sarah Cole is the Mercy Hospital Program Director and is here with us this morning to talk more about this. Good morning to you.
Good morning, Margie.
Yeah,
it's nice to be here.
Yeah, thank you. So what is the goal of adding this fourth year?
Absolutely. Well, as you mentioned, obesity is on the rise in the United States, and with that comes a rise in the associated health conditions like high blood pressure or diabetes. Physicians historically receive training in how to treat those associated conditions, but not so much in how to treat obesity as the potential cause of those conditions in the first place. So we hope to shift that emphasis earlier in training and see if we can help prevent some of those conditions from happening in the first place.
Yeah, and not many hospitals in the U.S. are currently offering this fourth year option, right?
Correct. Not in primary care. We actually will be the first program to be doing this. There are weight loss centers that can, help people who have obesity, but the wait list can be really long to get into those areas. By introducing this training to our family doctors, that first point of contact for patients, we hope to increase access to those services for people who have obesity.
So how does it work for the family doctors? How many, can go and take that fourth year? It's slow, right?
It is, yes, absolutely. So the program is open to any family medicine resident who is training at Mercy. And we hope that more medical school graduates would be interested in training at Mercy to take advantage of this opportunity so we can grow the number of primary care physicians helping people who have obesity in this unique way.
Yeah, are we seeing any numbers going down at all when it comes to obesity?
No, in fact, they're on the rise, Margie. Currently, 42% of Americans have obesity, and that includes about 20% of our children and adolescents. So it does seem as though it is a growing problem rather than a decreasing one.
Yeah, with adding this fourth year, is the hope that we will eventually see these numbers start to go down?
Correct. It will be interesting to track those rates in the St. Louis area as we grow family doctors in the community who could be offering some of these services.
Yeah, have you already heard from some of these doctors that they want to participate in this fourth year?
We do, actually. We have our inaugural resident, Dr. Elizabeth Hoover, who will be starting with us on July 1st, and we hope many more will follow after her.
So she'll be the first.
She will be.
All right, very good. Well, thank you so much for coming in and sharing this news with us.
Thank you, Margie.
All right, Dr. Sarah Cole.